At 2 a familiar scene plays out in countless bedrooms. You are asleep when a bolt of pain clamps the calf so hard it feels like a fist twisting the muscle. You sit up, rub, flex the ankle, breathe through it, and watch the clock. 20 minutes later it loosens, only to strike again before dawn. If that is you, you are not alone. Clinical reviews estimate that up to 1 in 3 adults over 50 report nocturnal leg cramps, most often in the calves, feet, or thighs, and the sleep loss that follows drags down energy, mood, and balance the next day. Here is the first truth that surprises many viewers. This is rarely an inevitable tax of getting older. In many cases, it is a modifiable nerve and muscle problem that improves when you change what your muscles are doing in the hour before sleep and during the night. Mayo Clinic notes that most night cramps have no single disease cause, but reflect tired muscles and nerve irritation that become more common with age. Here is the second truth. Reaching for painkillers is not the smartest first move. The U.S. Food and Drug Administration has strengthened warnings that common non-aspirin anti-inflammatory drugs can raise the chance of heart attack or stroke, risks that can begin in the first weeks and rise with dose and duration. That risk matters even more in older adults who may also face stomach bleeding and kidney injury. Quinine is another drug many still ask about for night cramps. The U.S. Food and Drug Administration specifically warns against using quinine for this purpose because of serious reactions, including dangerous drops in platelets and heart rhythm problems. Pain relief without addressing the nerve muscle trigger is a short bridge that often collapses before morning. In this video, we will show you a different path. We will start with one simple bedtime habit that research in older adults links with fewer and less intense night cramps. Then build a complete plan that supports your muscles while you sleep and tackles common triggers like posture, hydration, and medications. We will keep it practical and safe, and we will point to the exact organizations and journals behind each claim so you can check the evidence yourself. Along the way, we will also flag the red signs that mean you should see a clinician sooner rather than later, such as persistent swelling, weakness, or cramps that wake you nightly despite smart changes. If this resonates, tell us in the comments how old you are, where you are watching from, and what time of night your cramps usually strike. Tap like so this reaches someone who needs a better night. And subscribe to Agewell for more clear, science-based guidance tailored for people over 50. Start with safety. Night cramps are usually benign, but there are red flags that mean you should see a clinician promptly. Go now or call emergency care if cramps come with chest pain or sudden shortness of breath, or if one leg becomes painful and swollen, which can signal a clot. Mayo Clinic advises urgent care for severe cramping that does not let up and office visits when cramps cause daytime fatigue or occur with true weakness or muscle wasting. Distinguish cramps from other problems. Restless leg syndrome is an urge to move with uncomfortable sensations that improve when you move and recur in the evening, which is different from a hard knotting contraction that seizes the muscle. Peripheral artery disease causes cramping with walking that eases after a few minutes of rest and may come with slow healing sores or leg color changes. Diabetic peripheral neuropathy often brings burning pain, tingling, or numbness that can worsen at night rather than brief, intense contractions. Now, the centerpiece. The single most effective habit for many viewers is a short bedtime stretching ritual. Why this works? Gentle, sustained stretches reset the sensitivity of muscle spindles and Golgi tendon organs, so the muscle is less likely to fire a protective spasm during sleep. A randomized trial in older adults found that nightly stretching of the calf and hamstring for 6 weeks reduced both the frequency and severity of nocturnal leg cramps compared with usual care. Evidence summaries in community-dwelling adults over 55 also report meaningful reductions after structured programs that emphasize calf and hamstring stretches, though some trials show mixed results, which is why correct technique and consistency matter. Your 7-minute protocol before bed. 1. Calf wall stretch. Stand at arm length from a wall, right foot back with heel down and knee straight. Bend the front knee until you feel a gentle stretch in the back calf. Hold 30 seconds. Breathe, switch sides. Repeat once. 2. Seated hamstring stretch. Sit on a sturdy chair edge. Extend the right leg with heel on the floor and toes slightly up. Keep the back straight and hinge forward from the hips until you feel a stretch in the back thigh. Hold 30 seconds. Switch. Repeat once. 3. Side-lying quadriceps stretch. Lie on your left side with a pillow for head support. Bend the right knee and gently draw the heel toward the buttock with the right hand or a towel. Keep the back neutral. Hold 30 seconds. Switch. Repeat once. If balance is limited, perform all stretches near a wall or while seated. Aim for comfort, not pain. Do this every night for 2 to 4 weeks before judging results. Support strategy 1. Optimize sleep posture with smart pillow placement. Small changes in how you position your legs can quiet the nerves that trigger a night cramp. If you sleep on your side, place a pillow between your knees to keep the hips and spine aligned and to prevent the lower leg from twisting. Mayo Clinic clinicians note that side sleepers without a knee spacer place extra stress on the hip and low back, while a simple pillow restores alignment. If you sleep on your back, slide a thin pillow under both knees so the knees are slightly bent. This eases pull on the hamstrings and calves and reduces excessive arching in the low back, a setup that many older adults find more comfortable. Guidance from both Mayo Clinic and Cleveland Clinic supports the under-knee bolster for back sleepers to relieve lumbar tension. Finally, loosen tight bedding at the foot of the bed so your toes are not forced downward all night. Mayo Clinic explicitly recommends loosening the sheets and covers at the foot to help prevent night leg cramps. The side benefit is less morning back stiffness and deeper sleep, commonly reported when the spine is supported in these neutral positions. Support strategy 2. Fluids and electrolytes at the right dose and time. Hydrate steadily through the day, then ease off in the 2 to 3 hours before bed. The aim is balance. Over-drinking plain water can dilute sodium and contribute to hyponatremia, a state in which symptoms can include muscle cramps or weakness. Authoritative reviews and clinical references identify overhydration as a primary risk factor for hyponatremia and list cramps among possible symptoms. For sodium intake, follow the American Heart Association target of no more than 2,300 milligrams per day, with an ideal limit of 1,500 milligrams for most adults and especially those with high blood pressure. The goal is not zero sodium, but a sensible range tailored to your medical conditions and medicines. Consult your clinician if you use diuretics or have heart or kidney disease. Support strategy 3. Magnesium truth test. Magnesium helps muscle fibers relax after calcium triggers contraction, which is why many people try it for cramps. But the best available evidence does not show a clear benefit for typical nocturnal leg cramps in older adults. A 2020 Cochrane review concluded that magnesium supplementation is unlikely to provide clinically meaningful cramp prevention in older adults, though results are mixed in pregnancy. If you wish to try magnesium, favor food sources during the day such as nuts, beans, and whole grains, which support overall health. Be cautious with topical oils or creams marketed for rapid absorption. A peer-reviewed analysis found that claims of superior transdermal absorption are not supported by robust science. People with chronic kidney disease should not take magnesium without medical advice. Optional strategy 4. Emerging ideas and a quick cramp cutoff. Vitamin K2 has drawn interest. A randomized clinical trial published in JAMA Internal Medicine in 2024 reported that menaquinone 7 reduced the frequency, intensity, and duration of nocturnal leg cramps in older adults. However, in 2025, the journal issued a notice of retraction and replacement for that study. Until the corrected data are fully vetted, treat K2 as promising but preliminary, and avoid it if you take an anticoagulant unless your physician approves. For cutting off an acute cramp, some athletes use a small sip of pickle juice. Laboratory studies show it can abort an electrically induced cramp faster than water, likely by triggering a reflex in the mouth and throat that inhibits overactive motor neurons rather than by restoring electrolytes. Be mindful of the high sodium content and use only as an occasional rescue, not a nightly routine. Strategy 5. Audit your medicine cabinet with your clinician. Several medicines have epidemiologic links with leg cramps. A population-level sequence symmetry analysis in JAMA Internal Medicine found that prescriptions for thiazide-like diuretics, potassium-sparing diuretics, and long-acting beta-agonist inhalers were followed by higher rates of cramp treatment, whereas the association with statins was smaller and uncertain. The authors emphasize that these are associations rather than proof of causation, and randomized trials have not confirmed a direct cramp-causing effect. A clinical review in American Family Physician lists additional drugs occasionally linked to cramps and reiterates that quinine is no longer recommended. Never stop a prescribed drug on your own. Instead, discuss timing of symptoms relative to dose changes, check electrolytes and kidney function when appropriate, and consider alternatives if a plausible link emerges. Robert walked into clinic with a brown paper bag of pill bottles and a simple question. Could his pills be part of the reason the cramps kept waking him? We spread the bottles on the desk and looked at the timeline together. His worst nights began a week after his doctor increased a water pill and a month after he started a long-acting inhaler for lung disease. That sequence matters. A large analysis published in JAMA Internal Medicine used a prescription sequence method and found higher rates of subsequent cramp treatment after starting thiazide-like diuretics, potassium-sparing diuretics, and long-acting beta-agonists. The signal for statins was smaller and uncertain. The authors stress these are associations, not proof, which is why you should never stop a medicine on your own. Bring the list and the dates. Ask your clinician to check electrolytes and kidney function and to consider alternatives or timing changes if a plausible link emerges. A clinical review in American Family Physician summarizes additional medicines that have been linked with cramps and reiterates that quinine is not recommended for routine use. Here is your 7-day launch and 4-week build plan to put control back in your hands. In week 1, own the routine. Do the 7-minute pre-sleep stretch every night. Adjust your sleep posture with a knee spacer if you lie on your side or a thin pillow under both knees if you lie on your back. Loosen the bedding at the foot so your toes are not pinned downward. Start a simple cramp log. Each night record the number of cramps, the time, a pain score from 0 to 10, what may have triggered it, and which action helped. Weeks 2 through 4 are about consistency and fine-tuning. Keep the bedtime stretch and add 2 brief stretch breaks after breakfast and lunch if cramps were frequent. Spread fluids through the day and ease off in the evening. Keep sodium in the safe range that you and your clinician have agreed upon. Raise daytime movement a little each week so muscles do not shorten from underuse. Every 7 days, rid your log like a detective. Look for fewer wake-ups and lower pain scores. That pattern of small numbers is your quiet proof that the plan is working. If you are 2 to 4 weeks in and cramps still wake you, troubleshoot with a calm checklist before you change course. First, audit your technique. Stretches should be gentle and sustained for about 30 seconds, repeated 2 to 3 times per side, never bouncing, and always within a comfortable pull, not pain. Poor form underdoses the reflex you want and overstrains the tissue you are trying to calm. If nights remain rough, schedule a medication review. Several commonly prescribed drugs can shift fluids or irritate muscle and nerve, and a clinician can check electrolytes and kidney function and look for better timed dosing or alternatives when appropriate. Persistent or worsening symptoms deserve a broader look at contributing causes such as chronic dehydration, low iron, neuropathy, or vascular disease. Mayo Clinic advises office follow-up when cramps cause daytime fatigue or occur with true weakness or muscle wasting, and urgent care for severe cramping that does not let up. You can also discuss sleep-friendly relaxation add-ons. Evidence syntheses in older adults show that non-drug approaches like mindfulness training, gentle exercise programs, and manual therapies can improve sleep quality scores, which indirectly lowers cramp risk by reducing arousal and muscle guarding at night. If you and your clinician are considering vitamin K2, know the evidence is evolving. A randomized clinical trial in JAMA Internal Medicine reported fewer and less intense nocturnal leg cramps with menaquinone 7, but the journal later issued a notice of retraction and replacement. While the data are corrected, treat K2 as promising but provisional, and avoid it if you use anticoagulants unless your physician agrees. Now let us clear up 3 stubborn myths. Myth 1. Only drinking a lot more water will stop cramps. In fact, chugging large amounts of plain water after dehydration can dilute electrolytes and lower the threshold for an electrically induced cramp in laboratory studies. Balance and timing beat volume. Sip through the day and ease off before bed. Myth 2. Cutting salt to 0 is healthy for everyone. The American Heart Association recommends no more than 2,300 milligrams of sodium per day, with an ideal limit of 1,500 for most adults. The target is a sensible range, not 0, and needs to be individualized if you take diuretics or have heart or kidney disease. Myth 3. Magnesium will surely cure night cramps. The most comprehensive Cochrane review concludes that routine oral magnesium is unlikely to provide meaningful prevention for typical nocturnal leg cramps in older adults, though it may help in special settings such as pregnancy. Food sources remain a smart choice, and any supplement should be discussed if you have kidney disease. Here is the core message, illustrated by a real-world pattern we see often. A viewer in her 70s logged nightly calf cramps for 3 weeks. She learned the 7-minute pre-sleep stretch, loosened tight bedding at the foot of the bed, sipped fluids evenly during the day, and stayed within the sodium range set by the American Heart Association. She also reviewed her diuretic timing with her clinician. By week 2, the cramp count fell by half. By week 4, she slept through most nights. Nothing exotic, just muscle and nerve care matched to how cramps start. If this helped, share your progress in the comments. Tell us your age, where you are watching from, and what time you do your bedtime routine. Like the video and subscribe to Agewell so we can keep bringing you clear science and simple steps each week. Small, consistent changes bring back deep sleep and stronger days.